So, okay, Hileni, can you hear me? Okay. Good morning once again. My name is Dala, and I will take us through the literature review. So, starting with the question, what are the drivers of informal traders in the Oshikango region and Santa Clara? So, there are several reasons for informality, and the three main reasons are administrative barriers, financial education, and unemployment. So we know that the Oshikango region is part of Ohangwena, and the Ohangwena region is the second most populated region in Namibia in terms of density. And there is a correlation. Whenever there is high population density, there is a need to increase the products and services, infrastructure, private services, and public services as well. So this is not the case when it comes to Oshikango region. There is few mental health infrastructures. There is lack of enough infrastructure in this sense. There is also limited job opportunities. So carry on to the next slide. We also advocate for simplified trade regimes. Simplified trade regimes is a system that facilitates in terms of registration for traders. It makes it easier to register, simpler and faster, and everyone benefits, the traders, the government, and the people of Namibia. So the traders, they benefit from the legality aspect. They will be able to gain the recognition from the government, and the government eventually from the monetization aspect as well. They also benefit in terms of control. They will be able to have more control over the traders and so on. So it also reduces complexity, enhances compliance, and streamline operation. So there are also key policies interventions that we advocate for. The simplified trade regimes, as I mentioned, the financial inclusion and capacity building. Capacity building and financial inclusion are crucial, especially when it comes to informal traders. We know that informal traders don't have the benefit of legality like formal businesses. They operate unrecognized by the government. For example, a formal business like ShopRite can lose its product, and they also have the government support in that sense. But when it comes to informal traders, if they lose, they don't have the recognition, they don't have the support, and most often they are not allowed to have access to loans and credits as well, for obvious reasons, of course. And we believe that bringing awareness to this topic will help us simplify this process. So there is also another issue in terms of culturally sensitivity. We believe that mental health interventions are crucial, especially in Namibia. We believe in literacy campaigns, peace supports, and overall society embracing informal traders in a way that they are conducted to the right direction. Many people are suffering from mental difficulties, but there is a stigma in this topic. People don't tend to take it serious, but it's more serious than we think. Many people don't disclose And we highly encourage people to seek for help whenever they are suffering from mental health issues, depression, traumas, and so on. It's danger when people don't even acknowledge this fact. And this is not a weakness, recognizing a step back, it is actually a strength. So, thank you so much. We'll proceed with Hedimbi.
A very good morning to everyone. My name is Hedimbi. I am going to talk about the research methodology. These studies will employ the qualitative case study approach just to explore the social and mental health challenges that are faced. Microphone. You cannot hear me. Can you hear me? Proceed. Oh, informal close borders operating between Oshikango and Clara. The quantitative case study design is appropriate for this study because it will allow for deep and contextual understanding for participants, for the people that are lived experience within their real world settings. About the participants, the study will target 15 informal cross-border traders that will comprise 11 women and 4 men. These gender distributions, it will reflect the predominance of women in informal trade within the Southern Africa, while also it will ensure that male perspectives are also represented. Data collections. Data will be collected using the same structured interview, which will be providing a flexibility for participants to express their view openly while enabling the researcher also to probe the insight. The interview will be conducted in Oshiwambo and Portuguese, just in order to ensure clarity and comfort, and also cultural relevance. And all the response will be translated in English for data analysis. Ethical consideration. Participants will be informed about the purpose of the study and their voluntary participations and their right to withdraw at any stage without any penalty. Also, informed consent will be obtained from all the participants, and confidentiality of their identity will be strictly maintained. So in conclusions, this study is aimed to shine a light on the social and mental health challenges faced by informal cross-border traders. The study is also expected to contribute to the valuable insight into the interconnections between the informal trade, mental well-being, and resilience. Overall, this research seeks to promote a deeper appreciation of the women dimensions in informal trade, and also to advocate for inclusive supportive systems that recognize the importance of mental health, gender sensitivity, social economic empowerment among the informal trade. Therefore, let us not turn a blind eye to those who keep our borders alive, because when we lift others, we all rise together. So borders may divide countries, but understanding may unite humanity. Thank you.
Thank you so much, Judith. Great resilience through this presentation with all the challenges. Thank you for keeping with us. So our next presentation is from Ella Kisting, and she is going to present on the role of workplace wellness programs in enhancing employee mental health in Namibia. Thanks, Ella. And when she's finished, we can move on to questions and answers.
Consider that.
Can you put on a PowerPoint presentation? You have that. Yeah, that one.
Okay. Okay. Morning, everyone. I'm honored to be here today. My dissertation was actually, the time when I did my dissertation, I was working at Mediclinic as a clinical facilitator. So I was giving training to nurses. When I conducted my study, I wanted to look at the experience of the registered nurses working in ICU and how did they deliver care to the COVID-19 patients. But when I started to dive deeper into it, I actually noticed that we as healthcare professionals, we don't really get the support of our mental health, because as we are taught, we need to be there for our patients. We need to take care of our patients. We have to go on. If someone passes away, the bed must be cleaned and we must move to the next one without even showing emotion. So when I conducted the study, I got actually a view from the participants that they actually need mental health support. And it's lacking a lot, especially in our healthcare, and our healthcare professionals are not really getting it because there comes the stigma. We doing nursing, so we need to be coping, we need to be the strong one, which can never be always the case. So you can move to the next slide. Okay, so the background of the study was a growing workplace concern in Namibia. And with COVID, we all know it worsened. It was burned out because these participants actually had to work longer hours, more days, and be in hospital frequently. And that causes a lot of anxious, because when you do a resuscitation on a patient, there comes a time where your mask will fall off. So then you also get the exposure of the COVID, or you might think you will get the exposure of the virus as well. And so there's actually a very limited literature review on the structured role of such programs in enhancing employee mental health within Namibia. I actually have this work, I've got a reference down here on the slide. It's actually one of the students at one of the universities that actually quoted, "Workplace wellness programs are increasingly recognized as a vital mechanism for addressing psychological risk, because reducing stress and fostering resilience among employees. Despite this recognition, limited research exists on the structured role of such programs in enhancing employee mental health within Namibian context." You can move to the next slide. Because the time when I did my dissertation, it was just in the middle of COVID as well as at the end of COVID. So that's why I incorporated both into my dissertation to make a more impact and have a better result. So the study aim was to explore and describe the role of workplace wellness programs in promoting employee mental health in Namibian organizations. You can move to the next slide. The objectives is to identify benefits of workplace wellness programs, examine challenges in implementation it, and recommend strategy for stronger programs. Because of implementation, it can be a challenge. Actually, recently I moved to the medical aid field. So there would be a difference between the hospital setting where I did my research and when I did it now as the administrator for medical aid, because that is two different environments. That's why it's so important to restructure and implementation of any protocol or policies according to the environment these employees are actually in the current situation, because our selection will be different. Okay, next slide. The methodology was a qualitative research study, which played a very important role to me as the researcher, because then I can interact with my participants. It was interviews and obviously literature review. And then TESH method was used. The employees were registered nurses in the two private hospitals in Windhoek. Wellness interventions. Employer assistance programs is very important, because when I conducted my interviews, a lot of the participants after the COVID, actually, they opened up more. They said there was not debriefing sessions for them. So they couldn't actually debrief because they need to go to the next patient. They had to work extra shift They were anxious because their family members were exposed, or some of them even lost family members. They were the only breadwinners because maybe the husband was retrenched, so they need to work extra. And they couldn't outspoke themselves because they were in the position of just concentrating on the now, being there for the patients and assisting them. And physical health initiatives, peer support networks. Like the previous speaker said, stigma is still around. So if you have peer support systems, it will actually benefit more because then you can open up and you know you're not alone. But unfortunately, there's always a stigma that you are just dramatic, to be simple. So counseling service, employee assistance programs, physical health interventions, and stress management workshop. It plays a big role because we need to relieve our stress and know how to manage our stress levels as well. Next slide. The significance of the study was a contextual workplace wellness in Namibia, provides evidence for policies, organizational reform, and supports healthier, more resilient workplace. The key findings. This was the positive impact. It reduces stress levels, increases resilience, greater job satisfaction and engagement, improve workplace morale. These findings underscore the need for Namibian organizations to initially wellness frameworks that are culture appropriate, accessible, and responsive to employees' needs. Because we are a multicultural and diversity in Namibia, it's important that we also understand that we come from different backgrounds and different cultures. And as on a management level, this is just extra that I'm adding on, is that in the research study, a lot of the participants actually viewed they didn't have the support from their managers. So there was a lack of assistance. And we need to have that emotional intelligence and know our employees as an individual to understand, with this person, I can talk that way. With that person, I cannot mention that. So I need to have people skills and learn my employees as an individual, the manners they are having, what will trigger them. And not being on a social background, but in a professional way as well. Because then you can actually notice if an employee has suicidal thoughts or is in depression or anxiety, just by their body language, by the way they approach you. So, and that actually on my study, I actually found out there was a lack of that, perhaps because the hospitals were busy, they had meetings, they had to reorganize the staff and stuff like that. The challenges is low awareness of mental health issues, inconsistent implementation, so it varies because there were not direct policies in place in the organizations. So they can't really set a certain standard and implement. So that makes it a bit difficult because one person who's running a unit will decide, no, that's going to work for my staff members by calling in the chaplain, for instance, to speak to them. But he's not always around. And sometimes we need that in-person connection as well, or even telephonically or via, like we are doing now, like Zoom or anything else. So like I mentioned before, there's a lot of stigma around mental health, and we only come to realize it in certain time of the year, and that's mostly in September, but it's been around, and people are still having depression and anxiety, and we can't exclude our healthcare professionals because they are actually the ones also just human. So the recommendation was to integrate wellness into core strategy, train managers to support mental health, invest in sustainable wellness resources, monitor and evaluate programs' impact, because that is important. You can't just start resources and train managers, but you don't have any feedback, or you don't have any, you need to have that type of feedback to understand that, okay, this is working for my employees. I will continue. What can we improve to make it better before something happens? Build a culture of openness and reduce stigma. So that's why it's so important to train your managers in support of mental health. Because coming from a background of, I'm a registered nurse by profession, by the way, so a lot of times the stigma around, we are scared that people will see me as someone else. The perception who I am will be much more different. And I will not talk about it because maybe I don't trust my manager. I will not tell them because then they will tell the other staff. That's why it's so important that the managers in any organization, not only in hospitals, anywhere, any setting, should actually have a proper training so that they can guide the employees about their mental health. Okay. Next slide. Okay, in conclusion, workplace wellness programs are vital for employees' mental health. The benefit, it improves well-being, resilience, and productivity. There will be less absenteeism because then the employees will come to work. They will not want to be off sick. So we need to call for action, commit, and culture change. And that is because of stigma. That's why we need to encourage culture change within our organizations. Workplace wellness programs are not only beneficial for employee mental health, but also serve as strategic investment in organizational performance. The employees will also perform better. Lastly, it's just a quote. It's not part of a dissertation. A healthy workplace is not one that avoids stress. So stress will always be there, but one that builds strength and balance through care, connection, and compassion. Thank you so much.
Thank you so much, Ella, for that. I just wanted to check in quickly that the other two presenters are not here. That was Daniel, I apologize, Thomas, Teresia, Maria, Ndawedwa, and Loide, Mumwoye, and Markus T. Daniel. So I conclude then on these discussions for the day, and we can move on to the questions and answering session. So for our first discussion, that was understanding the social and mental health challenges in informal cross-border traders, a case study of Oshikango and Santa Clara. Any questions for our presenters? Our presenters, you can maybe come forward. Or is there a mic? Do you just want to move forward, presenters, for the first presentation? Questions and answering, please, guys, come forward. Are there any questions for them? I do have one question. Okay, our first question, Dr. Malundu.
Yes, good afternoon, it's already past 12. I just want to find out the Oshikango trade border. Is it a proposal that you presented, or was it a finding, or was it a study of the results of the project?
It is actually a proposal that we presented.
Okay, okay.
Yes.
I'm not sure when I look at your objectives, it does not come out very strong when I link it to your research title. Yes. You have to look, because your objective needs to be smart, and I don't see that come up very clearly. So you have to see whether your objective does reflect your research title. Secondly, coming on your research title, I think the wording is a little bit too long. Standard wording limit in research is between 12 to 15 words by average. So you have to look into that. My second concern is your population. It did not come, your population is based in Ondangwa, in Oshikango and Santa Clara. So it's two different countries. So I might foresee some limitations. So that did not even come through in your research proposal on your limitation. And your population is clear, but then from your population you have to draw your sample. I don't see any sampling procedure. So I assume this is a qualitative until data saturation, so the sampling does not come out very strong. Population is there, but the sample, it does not. So you just need to look into those aspects. So that's my question for now. Yeah. Thank you.
Yes. So, yes, I think these are very smart questions, actually, because the thing that happened is that we try to include the mental health aspect to our original topic. So it is very smart concern. It's because our original topic is the challenges faced by cross-border traders. So due to the conference that we are having today, we also joined the mental health aspect. So in terms of the sampling, yes, it also is a big concern. We are carrying this investigation. It involves 2 countries, 2 borders. We are aware of that. And yeah, I also learned a lot from your question, actually. And the methodology, I think, yes, we are doing a qualitative study approach. Yes. So there you go. Yes.
I actually also have a question. I also thought there's a lot of emphasis on your social challenges, but mental health for me didn't come through at all. Just wondering, how are you going to gauge and what are you going to ask to assess mental health? It's almost like it shouldn't be there, according to me. It speaks very much to the social aspects, but not to the mental health aspects.
Yes, we have to take into consideration, it was a short presentation. I had like 15 minutes or less, and I tried to go into the mental health aspect. But I believe that since this is a proposal, in our original presentation, we will talk way more about the mental health aspect.
Any other questions? Thank you so much. We appreciate your time and being here today. Thank you. Continue your hard work. Okay, our next presenter is Anna Kisting, and her title was The Role of Workplace Wellness Programs in Enhancing Employee Mental Health in Namibia. Any questions?
My name is MsTeopolina. I'm a human resource development practitioner, and I'm just asking myself as to whether perhaps is it not time that we also need to just look at mental health as something that takes place in a vacuum, because it is a contextual phenomena which takes place within organizations. And perhaps we need in this country, because I'm hearing so many complaints, and also from my own experience, I've been in the public service for many, many years. I started in secondary education. went to Ndawedwa College of Education, UNAM, and NIPAM, all over. Perhaps we also need to look at our organizations, how we organize ourselves as a society. Are our organizations up to scratch in terms of the new age? Are they configured in such a manner that they will bring out the best in people? Are they healthy the way they are put together? Because I follow the history of organizations, the current organization structures, Tayloristic organizations, hierarchical organizations that have their roots in the military. Are they fit? So what I'm saying is perhaps we need to go beyond the affliction, the mental health itself, and look at also our organization, how we organize as a society. Well, I don't know if it's a question, but it's an issue I'm raising that we need to look at. Thank you.
Thank you so much. That was a good statement. I totally agree because like I mentioned, when I did my dissertation, I moved jobs. So I was in the hospital setting and I moved to the medical aid industry. And it's not an isolated, mental health is not an isolated condition. Even now, as we speak, last month and in the beginning of this month, there were students in schools that tried to commit suicide. So not only just in an adult setting, but as for our students, our youth, our Namibian youth are also in danger. So if we start with the groundwork from a small age, we will have more, the stigma will be removed, we will have adults that will be able to cope, that will know where to go when they're not feeling okay. But unfortunately, like you mentioned, our society, where do we start with it? Thank you.
There is no sound? Okay, there is sound now. I look at your title. It says the role of workplace programs in enhancing employee mental health in Namibia. Now, again, like with the previous one, where was your setting for your research, which actually resemble your sample again? Because when you talk about Namibia, so your target population need to represent at least the population of Namibia, but at least through your sample. Now, the inclusion and exclusion criteria did not come out very strong that can indicate what type of sample did you had during your data collection in the field. Secondly is your recommendation. Your recommendation, your conclusion sounds more like a recommendation than the recommendation. So I don't know, maybe because of time that you did not present the recommendation, but I think this was a very good study, I believe, and I would have recommended that the significance of the study is that this will be a build-up of further study, because COVID was during 2019 and 2022, 21, around there. So the data might be outdated. So we are in 2025. So if one should use a follow-up study and use your study as a baseline, you know, your recommendation needs to be quite very clear. Yeah. Thank you.
Thank you so much. I totally agree. Because I had, on my study, the limitations was because I was limited to 2 hospitals only. And it was time consuming and constrained as well. So my pilot study was from 1 hospital and the other one was obviously my main study. So at the end of the day, there was not really a summarized for the whole Namibia. Unfortunately, I'm based in Windhoek, so it made it much easier. And I would definitely want to go further with my study on a PhD level to see how far we can go, because that is a great concern. And to start from the youth athletes, our adolescents, that is also, at the end of the day, our future. They will take our places over one day. And if we not start grooming them correctly and knowing them there's help out there, what will happen to our country? Thank you.
Thank you so much for your presentation. My name is Maud Nyambe, Mrs. Nyambe. I'm a lecturer at IUM. Most of the questions Dr. Mlondo has already alluded to. So what I would just say to you is that I commend what you've done, and please, if you can do more research on that. Mostly we look at these caregivers. We sometimes forget that they are human beings as well. So for you reaching out and finding out their mental status, I think it's something that is commendable. So thank you so much for your presentation. Thank you.
Thank you so much. While adding on just what she said, during the time when I was working at the hospitals, I was not only just a clinical facilitator, I also assisted with occupational health. So I also worked like the others, but it made my study easier for me during and after COVID and to interact with them, because for the employees, it was much easier to come to me because of they know I'm doing the occupational health and I'm the clinical facilitator. I will not just penalize them because they can't do a procedure correctly or they perform it incorrectly. I will advise them accordingly. So it was in favor for doing my dissertation, but like I said, I will really go further with my study. Thank you.
Any other questions? I actually also thought of something, because like you mentioned that probably each workplace would need a different type of approach to employee wellness, because there are quite a few employee wellness programs running. So did you benchmark? And then what I also wanted to know is specifically for nurses, because your problem brought up something that's close to my heart, is the debriefing of nurses going through traumatic events whilst working, which is kind of just neglected and we just move past the next day. So that's almost like a separate thing from an employee wellness program, which could be run by the employee wellness program, but for me, there's a lot of need there as well. And it's almost like that, yes, it falls under that, but in a way it's also separate. It's not really part of a problem that I would see for employee wellness, but looking at nurses, yes. So my question is maybe, how did you benchmark, especially if you say for Namibia, what did you use to benchmark employee wellness programs in your study?
During the time of COVID, and I hope I'm going to answer correctly, and afterwards, I've realized there's not really structured protocols and policies in place to assist healthcare professionals. Like my study said, it was for registered nurses. But we should also remember, in a hospital setting, they're not the only ones. And wellness is a broad topic. It's a broad topic. And there, in the setting that I did my dissertation, there is also administration staff. And they use different types, the setting from the registered nurses or nurses and the administration staff are not the same. So at the end of the day, I didn't put them in because my study was limited only to registered nurses. So that's why I incorporate some of the stuff that is also in my proposal. It comes from the organizational, from a hospital setting, but we need to realize that even though there's different sections in different organizations, so that's why it's so important for a manager to be trained and to know what will work for your employees, for your staff, irrespective if it's now in the hospital or an administration level in any workplace. because there will a bit of difference in between. For benchmarking, I actually got involved with the Ministry of Education but this is now for the youth. It's not for the nurses. So I'm between of doing for the healthcare professionals and doing for the students in schools. So, because both are my passion, and unfortunately I have to choose which one. But I started to engage with them as well in order to also be more involved in the youth as well and see how we can also assist them.
Any other questions? I was also thinking about you mentioned quite a lot about characteristics of what the employee wellness manager maybe should look like, but there was not a lot of mention on what a program should look like. But maybe that's in your study. Okay, so I conclude with session 4 this morning. The first session is finished, and thank you so much for attending. We appreciate your time. Thank you, everyone.
Afternoon, colleagues. How are we doing? Are we happy with our mental health now? Okay, so for our next session, we have 3 presenters. I just want to check if they are all here. I see Dr. Penelao is here. Are the other presenters here? Are you presenting? So 2. So all 3. Okay. So due to the technology that had delayed us, I think we are a bit behind with time. We can start so long. My name is Panduleni, and I am actually happy to chair this session for you. It's on climate, urban, and environment. And I think climate is very interesting. I mean, it's that one thing that we trust science, but when it comes to climate, we don't want to trust science. On Sunday, we go to church and we say God created the earth before humankind, but we don't want to acknowledge that the earth is changing as we evolve, actually. So we are just now stuck in there. Yeah, so the discussions for this session, they will actually give us a good reflection on our shared responsibility to protect what was entrusted to us, which is our climate and our environment. Of course, you have the urban component as well. Most of us are now living in the urban areas. Economically, that's where the opportunities are. So it's a very significant area as well to discuss. Okay, so our first presentation will be done by Ms. Lydia Hafenanye, and it's on road transport and greenhouse gas emissions in the central northern regions of Namibia, and then focusing on implications for sustainable mobility. Ms. Lydia, is Ms. Lydia here? Oh. Online, maybe. Because I have 3 presenters and I had 3 people that said they are here, so now I'm getting confused now. Or some of you are in the other. Okay, so perhaps we can go to the next one. Is he online? Who is operating the machine? Who is operating the machine? No. I wouldn't. If somebody's online, how will I know? And that's what we are trying to find out. Yes. Miss Lydia Afenanye, are you online perhaps? I don't see Lydia on the internet. Yeah, we don't have any response from Miss Lydia to see if she's online. Yeah, I also don't see any Lydia name. Yeah, I think perhaps we can just go on to the next one. The second on the program is by Dr. Penelao Nangolo and Ms. Loide Kandombo on assessing the socioeconomic impacts of drought in Onipa constituency. Dr. Penelao. Yeah, so after the presentation, we will have all the presentations, we will have the questions as we did with the previous session. Thank you. The floor is yours, Doc.
Good afternoon. Thank you, Chair. Oh, he stepped out. Thank you for this opportunity to sorry, okay, I think it's fine now. Good afternoon once again. I'm Penelao Nangolo. I'm here to just give a brief presentation on a study that I did with Loide Kandovo. We were looking at, or we were rather exploring drought-resistant strategies for rural communities. And we specifically looked at Onipa constituency in Oshikoto region. Just to give a little emphasis on the drought topic. Drought is actually one of the phenomena that are brought about by climate change. And you'd see that also in most cases, linking it to social issues, they can also lead to mental issues in our community, especially the people that rely on, should I say, agriculture, right? Can we move on to the next slide? Yes, so worldwide disasters and emergencies present significant health, social, and economic challenges to regional development. And the impact of drought in Africa alone is significant and yet multidimensional, affecting millions of people and many communities across the continent. And that's based on the studies that were done as indicated. Next slide, please. So according to a study by Intali and others, it is reported that climate-induced hazards, especially prolonged droughts, have intensified over the past 30 years that's of course Cameroon, and just looking at the African picture. And these droughts have led to reduced agricultural output, loss of livestock, and also poor health due to food and water shortages, prompting policy response to mitigate these impacts in the communities. And also in Malawi alone, a study that was carried out found out that drought have led to various health issues, including heat stress, headache, weight loss, diarrhea, and many other health complications in the communities. And another study that was done in South Africa have also concluded that poor harvest in the country or in South Africa has then made food insecurity worse. That's due to drought, and that's because many people can also not afford to buy the grains or the food that they could, And this shows that drought leads to crop failure, which negatively affect families, the diet, and worsen their financial hardships. Hence, we are saying that there are also economic implications that comes about with drought. And looking at the Namibian situation, Namibia is one of the driest countries in the Southern Sahara, and we face ongoing droughts here and there, and of course with multiple emergencies that were declared since the 1992. And in 2019, we actually experienced our worst drought situation in 90 years, which led to a decline in agricultural production, high livestock loss, and a widespread disruption of livelihoods. And I'm sure most of you can attest to that. It was really, really a devastating situation. In Onipa constituency, which is one of the constituencies in Oshikoto region, it is actually one of the areas where drought has significantly impacted the communities, leaving them at the mercy of poverty and hunger. Moving on with the problem statement, rural communities like those in Onipa depend on small-scale farming, and of course drought has caused loss of livestock and crops, rising poverty, hunger, and food, the spiking of food prices in the market. Families spend available resources, and that also, make their recovery harder and increasing the long-term risks that are associated with drought. And of course, despite the available interventions from the Office of the Prime Minister, community resilience is still a challenge, and we need to address that. Hence, then our study tried to explore strategies that could be implemented to strengthen community resilience in the Onipa constituency. Our study had looked at 3 objectives. The first one, to identify the socioeconomic challenges that are associated with drought in Onipa constituency. Secondly, to analyze drought response measures for communities in Onipa constituency. And lastly, just to make some recommendation on the strategies that could be implemented to ensure community resilience when it comes to drought. And in terms of the significance of this study, the study provides valuable insights for policymakers, and that is, of course, to help stabilize the livelihood of rural communities under the drought conditions, and also just to help the Office of the Prime Minister, especially the Disaster Risk Reduction and Management Unit, to review their strategies, and also just to look at their approach when it comes to assisting communities in terms of drought emergencies, and more specifically to look at the fact that we need to act before the emergency occurs. And in other words, we want to say that we should fund resilience and not respond to disaster. Moving on, in terms of the methodology, the study is a case study type of design using a qualitative approach. The population, we had a target population of 4,141. That is the households in the constituency. And the study population then constitute of 1,800 households that are severely affected by drought in the constituency. And these statistics are from the constituency office. And of course, we also included the personnel from the constituency office. The sampling method, we use the convenient sampling method by basically looking at or considering one household per village in the constituency, and of course one official from the office. The study used interview guide and a digital recorder, voice recorder to collect data. Moving on with the analysis, the study employed thematic analysis, which was done in the NVivo software. And yes, these are just the steps that were followed to analyze the data. Now, in terms of the findings, the study found out that in terms of socioeconomic impact, the communities faced agricultural losses in terms of the crops and the livestock, because that is what they are farming with. And drought also brought about water scarcity situation, which impacted, water availability in the households. And that also made it difficult for, small-scale gardens, and also in terms of livestock, right? And health implications, Maria? Health implications and, the well-being of communities. As I've said earlier, that drought is one of your, climate change-induced events that can also lead to mental issues in our communities. And of course, low income, because then loss in agricultural production can exacerbate to low income, because then these farmers or these communities have lost their production that they are supposed to sell at the end of the day. Moving on with the drought adaptation strategies that are implemented in the constituency, there is only one major measure that is, considered, and that is, of course, the drought relief program by the government, where food supply is then provided to affected households in the constituency. And the strategies that could then strengthen the mitigation measures that are implemented. Collaboration is one of the highlighted interventions that were mentioned, to actually have collaboration between the government and, the private sector, and also NGOs, to ensure that the we have efficiency in terms of responding to this situation. And in terms of agricultural resilience, the study found out that there's a need to support farmers with training, the necessary tools, and also to ensure that the farmers are also equipped with drought-resistant seeds or drought crop varieties that they can plant, to make sure that they still harvest something at the end of the day, even though they are faced with dry conditions. Nature-based solutions to address the impacts of drought are also one of the, findings that came about to make sure that we rather focus on resilience of communities and not responding to the disaster itself. Traditional practices and also the integration of indigenous knowledge was also highlighted to make sure that whatever we are doing of, modern interventions should not sideline the indigenous knowledge that these communities have. So these findings then revealed that, of course, drought negatively affect various aspects of life in the constituency, and that's particularly the livelihood or, agricultural production as the livelihood of these communities and food security. In South Africa alone, some people coped by eating fewer meals and buying extra food. And of course, despite the efforts to grow drought-tolerant crops, food insecurity has worsened, which then of course forced households to adapt negative coping mechanisms, selling their assets to make sure that they have food available for them at the end of the day, and also things like skipping meals, which will also lead to health implications, especially in the children. And these actions basically undermine the long-term resilience of these communities, because this is a short-term response to what is happening and not really building resilience in a long run for these communities. And small-scale businesses that depend on agriculture are struggling, and declining household incomes have increased reliance on the food aid program from the government, the NGO support, and this is also adding, pressure on the public resources. A report by the World Bank have actually indicated that drought worsens poverty, it disrupts local economies, and it also increases dependence on the aid that, especially the one that the government then provides to such communities. And high dependency on aid is common, right? But it's not a sustainable solution. As I've said, we need to build long-term resilience in communities and not responding to disaster. And there's often poor coordination between then the Office of the Prime Minister, the regional office, and constituency councillors, which also cause, a delay in food supply when it comes to assisting these communities. And also procedures to access funds for buying food are lengthy and complicated, and these challenges slow down timely resistance to those affected by drought situations. Now, to just conclude, of course, drought has affected communities in Onipa constituency, and dealing with drought we actually need strong and combined efforts that should then be done in a collaboration to make sure that this phenomena is tackled in our communities. And quick response is important while actually building the long-term mechanisms to ensure resilience in our communities. And as I've indicated there, that we can look into, adequate water supply, crop diversification, and also functional early warning systems that the communities can use to make sure that they are well aware of what they are expecting in, say, the growing season also. Collaboration at all levels, be it local, regional, or national level, can then help to reduce the social and economic impact of drought. The study made a few recommendations, of course, with the first one to make sure that what we are funding is resilience and not responding to disasters. We should consider nature-based solutions, such as agroforestry that our farmers or communities need to practice. Crop diversification, have multiple crops that are planted in the field. Just in case one type of crop fail, then you can still harvest the other remaining. We should also ensure soil and water conservation measures among communities, because this is actually one of the mechanisms that can be used to lessen the effects of drought in especially the farming environment. And adapting community-based early warning systems or response systems is very, very crucial, so that the communities or the farmers have information at hand of what to expect that growing season. And of course, not forgetting the climate forecasting to ensure or enhance resilience amongst communities. Thank you for your attention. That is the end of my presentation.
Yes, thank you very much. I think we can have a seat. I think then we can have the question after the next presentation. So then the next presentation is for Ms. Josephina Nguyepa, and it's focusing on examining the interdependence between tourism SMEs and economic sectors in the Erongo region, Namibia. Welcome.
Okay, good afternoon, and thank you so much. So today I'll take you through my presentation on examining the interdependency of the tourism SMEs and other economic sectors in Namibia. So moving on, that's the outline of my presentation, and we can move to the background of the study. Okay, this is just to give you an overview of how the tourism sector have been performing over the years. So if you look at your left-hand side, you see that that's the global perspective, and that's how the tourism sector have been performing. So it's contributing about 10.9 trillion to GDP globally. That's according to your figures for 2024 from the Tourism Organization report. And then in terms of jobs, it's contributing about 3.57 jobs, millions. So that's also in terms of traveling, international travel have increased in 2024. It increased about 11.6%. And if you look at in the Namibian perspective, that's should be on your right. So we can see the picture is a little bit different. If you look at 2011, it was about 3.9%. And then it declined a little bit in 2015 to about 3.5. And then it increased again in 2022 to about 6.9% contribution to GDP. So despite that, we can see that yes, I know this one will shock most of the people in the room. Despite the things that we talk about the tourism sector, it's still not regarded as a a sector when it comes to your classification of industries in the national accounts. So that's when you look at your NSA data, you will never find a sector there called tourism. So, and this is because according to the World Bank Group, they did not classify the tourism sector as a sector per se. So this actually create what we call interdependence. So it's more dependent on other sectors of the economy, like your accommodation, car rental, transport, and travel agencies, and so forth. So these have been acknowledged by other authors, like the Liu and Rian 2024. And this is because the sector is highly dependent on other sectors of the economy, as I mentioned before. You cannot really identify its own impact just independently. That's why it doesn't stand alone. And what do we mean when we say interdependency? This is just a situation when one sector sources its input from other sectors, and it's also supplying some of its output to other sectors. So there is various studies that have concentrated on the interdependency of the tourism sector, but then there's no conclusive evidence to say, okay, to which sector is really the tourism interdependent on? Which sector? So it's the findings are actually different when you look at China, Indonesia, and other countries that have focused on that. So my study is actually focusing on Erongo region. And I know most of us here, if you are Namibians, we know that Erongo region is one of the highest tourism destinations in Namibia. But then, despite that, the SMEs, there's about 105 establishments in Erongo region. But then of those is only 148, which are SMEs. So we can guess what is the other percent. So most of them, they are very, very small, which is micro establishment, and then the large ones. Okay, so what is really the problem here? It has been acknowledged that no, the sector is interdependent on other sectors of the economy, so it becomes vulnerable. And I know we have experienced this when it comes to the COVID-19 issue. So the tourism sector was one of the most impacted sector, and the main reason for this is because it's interdependent on other sectors of the economy. Yes, moving on. Okay, so despite that the tourism sector in Namibia have grown, as I have indicated in the background, that we are around almost 4% now in terms of contribution to GDP. The SMEs are still struggling, and they are lagging behind, and as you have seen before, that they are only contributing 15% of the total establishments within the region. And there is one study that was conducted by GOAB in terms of Namibia, and he really emphasized that the reason why most of the SMEs are not surviving in Namibia is because they are facing high cost of operation and also other economics factors that are affecting that. So this is done despite Namibia is actually having a strategy which is ending next year and is focusing on establishing SMEs as well, but then it seems like that strategy is not working. So that's why that strategy is actually supposed to support SMEs and also other emerging enterprises, but then we can see the struggle is still there. They are still lagging behind in terms of large establishment. And this actually also undermines the performance of the SMEs within the sector. Okay, moving on. So another issue when it comes to the studies that were done before, they are just focusing on hotels and restaurants. But if you look at the context of the tourism sector, according to the World Bank and also the Namibia Statistics Agency, which is the tourism satellite account that was published last year, the tourism sector actually comprises of transport, car rental, travel agencies, and other arts and entertainment. So that means the previous studies, they have actually undermined the performance of the tourism sector because they were just concentrating on hotels and restaurants. So for this reason, it actually limits the understanding of how really the tourism sector is interdependent on other economic sectors. So despite that, there is also no general agreement. So it depends on the context to say, okay, if the study was conducted in China, it can be the same country, but then if it's a different region, then they are having different conclusion. So there is still no sufficient evidence to say, in terms of SMEs, I haven't found any study that has actually concentrated on a specific economic sector like SMEs. They are all just looking at large establishments, and as we know, in most cases, the large establishments, they are the ones who have more influence. So the studies are more likely to be focusing on large establishment in terms of conclusion. Yes, moving on. So for this reason, I have about 3 objectives. And the main objective was really to develop an input-output model that can assess the interdependency of tourism SMEs in a Rongo region. And the first objective is actually to examine the interdependency of the SMEs in other economic sectors. So, and the second one is also to analyze the sectors from which it sources its input. This is actually your forward linkages. Backward linkages, and the last one is your forward linkages. Okay, moving on. So based on those objectives, yes, please, let's move. Okay, based on those objectives, the first one is actually having 6 sub-hypotheses. So the first one is concentrating on your accommodation, and then you have your restaurant until your arts and entertainment. So the first hypothesis there is just saying that there is no significant supply chain dependency between tourism SMEs and other economic sectors. So that's then now like jotting down to different subsectors that I have mentioned in the introduction. And the second hypothesis is talking about your, concentrating on the second objective, which is your backward linkages. So here we are just saying there is no significant difference when it comes to the sectors from which the tourism SME source their input. And the last one is focusing on your forward linkages, if they provide their output to different sectors in a different way, if there's a significant difference in the sectors where they provide their output. Okay, moving on to the limitation of the study. So this study was just conducted in a Rongo region. So perhaps further studies can concentrate on other regions. And also, it was really an issue when it comes to getting the financial information, because I actually use the company in terms of revenues and expenditure. So, and I conducted this study during a peak season. So that was one of limitation as well. And in terms of the delimitation, the study is concentrating. Yes, the study is collected data from 2018 to 2024. So other activities that may have happened not within that time frame, so they are not included. So this study is just concentrating on 7 years. And the reason I did this is because I wanted to also understand if the COVID-19 had any impact on the results. Okay, so in terms of the data, this study actually is a pure quantitative, and then it consists of both primary and secondary data. So both the primary and secondary data, they were, first I collected the secondary data from the Namibia Statistics Agency from 2018 to 2024, and then the second one is the primary data, of which I collected to SMEs that have been only in establishment since 2018. So that's why my population is actually 112 SMEs. But in terms of the response, I got a response of about 79, which is 71% of the total. Okay, in terms of the data analysis, no, please. Yes, in terms of the data analysis, I actually constructed what we call an input-output model for the tourism SMEs, and then I use what we call a location quotient. This is using your employment data your national employment as well as your regional employment. And this was done because there was no employment data for 2019. So I have to use what we call the geometric formula for me to get the employment for 2019. And it's actually represented by that formula down there in the second column. So in terms of testing the hypothesis, I actually look at the dependency, and I also tested the robustness of the model in terms of, okay, go back please. Yes, I tested the robustness of the model at 5% and 10% just to understand. But then what I realized is that there is no high deviation when it comes to when I use the employment data or when I use the revenue data. Okay, let's move on. Okay, this is just some of the results when it comes to now the input-output coefficients. So these coefficients, they were all tested with the bootstrapping method. So just to know that the coefficients are actually stable and they can be used to make policy decisions. And if you look at the first one, is your first hypothesis there. What that figure of 45 means is just that about 45% of the inputs that is used in the accommodation sector is sourced from other sectors within the region. And then when it comes to the restaurant, it's about 43%, but then the transport is the highest, so that means transport is highly interdependent when it comes to other economic sectors. And travel agency, car rental is the lowest dependent. So this doesn't mean that it doesn't need inputs from other industries, but what it means is that it might be importing most of its inputs compared to sourcing most of its inputs locally. Okay, moving on. So this is your second, let's move on. Yes, this is your second hypothesis, and this is one of the most interesting things that I got from here. When I was reviewing other studies, agriculture was coming out so much like it's the tourism sector apparently is dependent on agriculture, but if you look at down here, you can see that agriculture is like one of the lowest. So which means when it comes to the interdependency of this sector, it could be country-specific, geographically specific, and also maybe it's impacted by other factors like your climate change and so forth. So, and as we know that when it comes to Erongo region, it doesn't really receive a lot of rainfall, so it means perhaps they are sourcing most of their inputs from other sectors. But then we can see manufacturing there, both manufacturing of food items, that is really coming out strong. So that means the tourism sector in general. So this is the combination of all the subsectors, is your car and transport, travel agencies, and hotels and restaurants. So that means manufacturing is very important. And then that's followed by your wholesale and retail, which is about 0.82. And then you also have your water and electricity. The rest are relatively small, but then transport is also coming out a little bit strong, and other services. So your other services, these actually just include your lawyers and so forth, but you have finance that is very small, which I think it's calling for policy implications. And I think there is so many studies in Namibia that has explored when it comes to SMEs and financing issues. So I think this is a very strong recommendation that we need to finance our SMEs, because if you see from top there, it's very small per se. Okay, so when it comes to the forward linkages, this is actually where they are providing their output. So if you look at these figures, I think what is very important about this figure is that even when I tested the hypothesis, it was insignificant. What it means is that the tourism SMEs, yes, they source inputs from other sectors, but in terms of them providing inputs to other sectors, their impact is very small. And you can see they are having what we call intra-sectoral interdependency. So they are providing their output to mostly sectors that are related to tourism. If you look at the highest there, 0.29, that is actually your accommodation. That means that they are providing some of their output to other accommodation services and also restaurants. But the rest, you can see they are below 0.01, which is the industry average, which is just also calling for policy recommendations when it comes to collaboration. So they are supporting other industries when they are sourcing or they are buying from other industries, but other industries, they are not supporting them enough to say, okay, let's go buy from the local SMEs in the tourism sector. Okay, so just to take, you can move on. A quick look to say, this is more of your mathematical model to say you can use this in terms of if maybe there is money that is, let's say there is 1 million that we want to invest in the tourism sector, then we can actually evaluate this. There is what we call, there's also an Excel version which is quite flexible. And if there is any economic shock, this model is also able to pick up any economic shock. So moving on to the conclusion and implication. So I think what is very important as a takeaway for this is that the tourism sector tend to depict a different trend when it comes to smaller and large enterprises. So we cannot just make a conclusion to say, no, the tourism sector is interdependent on agriculture, for example, what other studies have found out. But when it comes to the size of the firm, it also plays a major role when it comes to the sourcing of inputs and also supplying of inputs. So they are actually having different trends, and that means their policy should be different from large establishment. And I think it's also very important to encourage collaboration with other non-tourism sector. We can see that the backward or the forward linkage was very, very small. So we need to strengthen that. But I think it's also very important to see that what we realized from the backward linkage is that it was more dependent on other tourism-related sectors. So that means our first priority should be given to the tourism SMEs themselves. If there's any investment to be made, let's not construct roads. Let's give the money straight to the SMEs instead of boosting other sectors. Okay, and I think it's also very important to promote what we call a growth at home strategy. You can just, okay, but it's fine. So, and also the model is also a practical tool that we can use. So this is your theoretical model. So this is just giving in terms of your policy implication. So the first one that we have there is your policy initiative that we need to do. And then we have what we call in the center, we have your supply chain integration. And then we have the SMEs on the side. So that means, I think one thing that I also realized when I was doing the data analysis is what we call the gender and position dynamic. They also seem to have an impact when it comes to the supply chain of the tourism sector and the flows of inputs and output. But then my study was not concentrating on that. So this is calling for further studies to be focusing on that. And then we have on the corner there, we have the multiplier effect, which is also impacted highly by the self-link. That means the sector is highly interlinked within itself rather than other sectors of the economy. And then we just have the demonstration of forward and backward linkages. But there by the top corner, we also have what we call regional-based industry. So it's very important when we are doing this policy or we are doing implementing any policy to look at a region and then what are the industries within that region. Okay, moving on. So in terms of future research, I think it will be very important for them to look at other regions as well and also to concentrate on other sectors. My study was just concentrating on the tourism sector. And I think it's also very important to look at other methodology like the computable general equilibrium model that is more like longitudinal in nature. So one can actually extend this to say, okay, I want to study this like maybe for the next 10 years, how is it going to impact the economy or how interdependent it is in the long run or in the short run. Okay, so that's the end of my presentation. Comments and critics are more than welcome.
Okay, thank you very much. Questions and comments and critics. has already said. Yes. How do we? Oh, okay. Thanks. Yeah. So for comments, perhaps you can just indicate, or perhaps you can start with the first presentation, and then yeah.
Well, thank you very much for the excellent presentations. Very, very informative. The first one on, sorry, I have brief comments on both. The first one on drought and up in the north. Excellent work. I'm very, very impressed. However, I was just thinking that, and this is not only for this particular presentation, there is those people who worked at colleges would be aware of the existence of action research, participatory action research, which also involves now the local people so that they can also be part of this. Now, I was very happy to hear that you're also interested in local knowledge, indigenous knowledge. It's key. So that's very good. It's an excellent thing, and I think you should continue doing that. But perhaps going forward, all of us, academics, we go out there, do research as people from outside, and we leave out the people. They should be part of the research. This participatory action research, and they can be part of solutions. And in that way, we empower them. But otherwise, excellent work. The last one, again, another excellent piece of research on SMEs. We have a presentation tomorrow on SMEs as well. I was very impressed again with excellent work, very, very impressive. However, at the end there, with regard to future research, I was expecting to also hear about the qualitative dimension, because like you mentioned, the phenomena seems to have contextual aspects or dimensions. And we know very well that quantitative research does not pick up the contextual and the cultural aspects. So perhaps we should also consider that. And it's a problem in this country. The Ombudsman spoke this morning about research that is not really moving us forward. And I think Africa, and Namibia in particular, needs to look at qualitative research. I was surprised the other day. I was looking at an article in South Africa. In the 70s, they were doing, the white government there, they were doing action research. And then it disappeared. I don't know what happened to qualitative research. It disappeared, but very, very useful. I know I don't want to monopolize it. There are other people, but think about qualitative research. Otherwise, excellent presentations. Thank you.
Okay, so thank you very much for the comments. I'm not sure if perhaps you can have reflections on the comment. Yeah.
Okay, thank you so much, Prof, for the comment. I think for the qualitative, I put recommendation for mix and qualitative. It's just that maybe the presentation was too short, but I think especially the mix part, it will be, because I was now like wondering, especially when I'm doing the analysis, now gender is just coming. I don't have a reason why gender is there. Like, it's just something that I could not explain because it was not part of my study, but thank you so much.
Yes, we have a comment at the back.
Thank you for this platform. I just also want to commend Dr. Penelao, the good presentation that she's done. I would like just to make a proposal, a suggestion that probably if you can reach out to the policymakers, because this can help us really sustain or alleviate the drought situation that we experience in our country, because your findings really will help our country move forward. I like the part where you mentioned to give the sustainability to the community than just giving him something that will not sustain them. So thank you so much, Doctor. That is just my proposal. Thank you.
Okay, do we have Dr. Penelao, you want maybe to comment on that, or we are good? Okay.
Yeah, thank you very much for the wonderful comments. I actually grew interest into disaster risk management, looking at drought and flood. Of recently, we had, was it a workshop that I sort of opened my mind in that dimension, and it's really something that I want to consider. And one of the things that came to my mind is that maybe the reason why the solutions that we keep proposing are not working is because we sideline the knowledge, the rich knowledge within the communities. And this is the indigenous knowledge that we need to incorporate in the solutions that we are proposing. Maybe that is the reason why our ideas are not working, and it's really something that I want to explore more. Thank you.
Okay, where's the mic? We have one last comment. I'm not saying one last, but yeah, one last comment.
Yeah, okay, thank you so much. I would like to maybe Dr. Penelao first. I want to comment on the topic. When I look at the topic, I thought I was expecting something more quantitative. So assessing, maybe advice, maybe doctor can look into maybe changing into investigation, investigating the socio-economic impact of drought. And then as a matter of fact, when doctor was presenting, I was still on my test because I was expecting, okay, how did doctor go about the socio aspect, the economic aspect, and then so on. So maybe doctor can come in and then maybe give a brief explanation on that one. And then as for the second presenter, also on the topic, when you say that you are examining the interdependence between tourism, SMEs, and economic sectors, and while you are presenting, you say that most of the researchers found that the tourism sector heavily depend on other economic sector. And my question is, why are you doing this research if you already have the answer? That is the first question. And then the second one is the robustness check. I think just to base on 5% and confirm that your data is reliable or accurate, I think you need to do more of robustness check, maybe to conduct some tests, especially the correlation matrix and then so on. Yeah, that will maybe give some meat to your result. Thank you.
Yes, if you would like to comment, please.
Yes, thank you very much for that observation. I actually didn't mention this, but the topic that is in the program was a different study that Loide did under my supervision. But when I looked at the data that was collected, there was so much that we could, write another paper out of it. And that's, of course, exploring the interventions or the measures that could strengthen the resilience of these communities. That is why what I presented is not really reflecting the topic that is on the program. Yeah, thank you.
Okay, thanks, Doc. It's just the issue of dynamics. I mean, no, it's fine. So,
Yes, thank you so much for the comment. The reason why I continue with the study is because the previous studies could not conclude to what sectors the tourism tourism establishments are they interdependent on. First, if you look at like most of the studies that I have found is China and Indonesia. Like you find same in Indonesia, but then when you look at, they do like maybe one island or maybe one town, like the conclusion is different. They are talking about it's dependent on manufacturing. And then when you look at another one, they are saying, no, it's interdependent on agriculture. And then when you look at China, they are talking like, no, there is a negative relationship between agriculture and the tourism sector. So that's one reason, because like there's no that conclusion. And also another thing is that the previous studies, they only look at restaurants and accommodation. So that means they have undermined the performance of the sector itself, because there's also transport, car rentals, travel agencies, and other tour operators. And also my study have looked at this like independently to say, okay, how interdependent is accommodation alone, how interdependent is transport alone, and so forth. And you can see like from the result, you could see like travel agencies, like they only source about 12% from the region. But then you look at transport, they are getting about 50% of the inputs from the region. So I think that's the major difference. And also the other issue is that I didn't find any study that have looked at to be specific to say, no, they are just looking at a specific economic sector to say, we are looking at SMEs separate. They are all just concluding to say, no, it's interdependent, but most of the, establishments, if you look at their database, it's like large enterprises, they have more impact compared to the smaller ones. So that's why I concentrated. Okay, mine, since Namibia SMEs, they are the ones facing challenges, so let me concentrate on the SMEs, which have never, I didn't find evidence on somebody who did that in terms of SMEs. Oh, okay. Robustness, I only did at 10% and 5%, so I think maybe it's more. Yeah, I would perhaps need to do more in terms of that, yeah.
Yeah, and then also maybe the second objective, instead of analyzing, just identify, because you want. Yeah, okay, thank you so much. And then also your second objective, yeah, it will be better if you put to identify, because you didn't analyze, but you just find out which sector it depends more on. Thank you.
Okay, so ladies and gentlemen, thank you very much. I believe lunch should be ready now. I think lunch tickets were handed out, and I would assume it should be in the foyer. Anybody has information on that? Okay, yeah. Thank you.